So we're going to get started. It is 7 o'clock Central Standard Time. I want to invite all of our guests and all of our business partners and all of our healthcare professionals to our Doctor's Edition. This is our Medical Advisory Board. It is a team of MDs, RNs, NDs, chiropractors, pharmacists, dentists. We're looking for veterinarians, but we truly are very grateful for every single member on our medical advisory board that brings so much knowledge as it relates to how cannabis, CBD can really assist and address a lot of conditions that we deal with on a daily basis. So I want to introduce myself. I'm Dr. Rita McGuire. I'm the Chief Medical Officer and one of the co-founders here at Wakana for Life. I'm also an obstetrician gynecologist of over 30 years. I attended Wayne State School of Medicine in Detroit, Michigan. I completed my residency in OB at Cook County Hospital, which is now Stroger Hospital. I'm also CEO of RJM Wellness and Rip Rita Fitness. I'm a global women's health and wellness speaker. I'm one of the certifying physicians for the Opioid Exchange and the Medical Marijuana Program here in the state of Illinois. And I'm a member of Doctors for Cannabis Regulation. So I am an advocate for the cannabis plant. This plant has shown over many decades how it can assist with lots and lots of ailments. Lots of pharmaceutical companies like Eli Lilly and Park Davis and Park Davis, Eli Lilly, and what's the other big one? GW Pharmaceuticals, for example, have been using cannabis-based medicine for years. And when prohibition hit, of course, they stopped, but this is where the cannabis plant really started in the pharmaceutical lane. So healthcare providers, we need to understand how cannabis works in the body, how it can assist our patients that we take care of each and every day. So our colleague, Dr. Sanjay Gupta, he really had to bring to light that we have been systematically misled about the cannabis plant, that we, as a profession of healthcare professionals, including himself, we didn't dig deep enough. We didn't look at all of the studies that were being done in the European countries as it relates to the medicinal benefits of cannabis. So he said yes to cannabis. Unlike his views in 2009 and 2014, he came back and said, yes, this plant can assist with a lot of conditions. So let's look at the cannabis family. It has two species, one on the very far right, which is marijuana. Well, that species makes you have a euphoric sort of feeling, right? Or a high. And it does that because one of the main constituents in marijuana is delta-9 THC. Now, marijuana has very small percentages of CBD or cannabidiol, which we're going to concentrate on tonight, but just know the reason why marijuana gives you the high is because of the delta-9 THC. The other species in the cannabis plant is called hemp. Hemp is the species that has very small amounts of THC. By definition, hemp is defined as containing 0.3% or less. It has very large amounts of CBD or cannabidiol, and this is why hemp gives you the health without the high. Hemp also has industrial uses. We can make homes with hemp. We can make books and clothes and textiles with hemp. In fact, the very first Model T Ford automobile was constructed from hemp, and the gasoline that it ran on was also from hemp. So hemp is a huge agricultural commodity, and we're going to learn very soon that hemp is a legal agricultural commodity that can be consumed, it can be cultivated, and even sold in all 50 states. So the point that I'm driving for healthcare professionals is that yes, cannabis is the family, but the family has two species, one being marijuana on the right that gives you the high because of the high THC levels, and then one that gives you the health, which is the hemp that has very small amounts of THC levels, 0.3% or less. So another factor on the what we call phenotypic look of marijuana is that the plant is usually shorter. It resembles a bush. It has more leaves and buds surrounding the body of the plant, which makes it very distinguishable from hemp, which is tall, it's thin, it can grow as high as 20 feet, and the leaves are bunched near the top of the stem. And again, the difference between hemp and marijuana is that one gives you a psychoactive side effect. The marijuana and the hemp has absolutely no psychoactive properties. And hemp is legal. This is a slide that I was alluding to, that the Farm Bill, which was passed in 2018, yes, it was an agricultural bill, but it also removed hemp from being a Schedule I drug, a drug that has no medicinal benefits. It has a very high potential for addiction and a very serious concern for safety. As long as hemp is processed in such a way that it contains less than 0.3% or less of THC, it is legal to be consumed, to be cultivated, and to be sold in all 50 states. So yes, Schedule I drug classification. We've been waiting since the 1930s for hemp to be removed from the Schedule I drug classification, but we are now excited even more because now hemp can be used in research. In fact, there are very many academic research universities like UC San Diego that they're doing research with hemp as it relates to ADHD and seizure disorders and eating disorders. A lot of research now can be done on humans since the 2018 Farm Bill. So let's talk about the only FDA-approved prescription CBD medication. It's called Epidiolex. Epidiolex is used for children to treat their seizures. Their seizures can be due to Lennox-Gastaut syndrome or Dravet syndrome or tuberous sclerosis complex, but just know that this particular medication is about $3,200, $3,500 a month, and it is the only FDA-approved CBD medication. It is a base of a natural CBD product along with synthetic and synthetic fillers that make up this medication. So that's why it is so expensive, and it is produced by GW Pharmaceuticals. There are other THC-derived medications that are FDA approved, right? It just seems like a hypocritical thing where we have cannabis on the marijuana side, which is a federally illegal, but we do have the FDA that allows for these medications to be prescribed by your own doctor. These are THC based, which means they will give you a high. Syndros. Syndros is used to increase appetite in patients who have AIDS. It's about $1,500 a month. Marinol is another medication that is FDA approved. Its base is THC, so it will give you that psychoactive effect. It's used for extreme debilitating pain, for those who have cancer, as well as Sesamex is another THC approved, FDA approved medication in the US that's used for those who have cancer and other debilitating conditions. Now, Sativex is a medication that's approved in the UK. It's a hybrid. It's a hybrid of THC and CBD. It's a 1-to-1 derivative, but again, not approved yet in the US, but it's another FDA-approved medication that we'll see shortly in the near future. So why are so many patients looking, though, to use the other side of the cannabis plant? the hemp side, the side that doesn't give you a high, the side that gives you the health benefits? Well, it's because patients are sick and tired of all the medications they're on, as well as all of the side effects that these medications cause. You know, I always talk about how one medication leads to another medication because we're chasing the side effect of that initial medication. And so before you know it, that patient that was on one statin is now on 10 other medications to address the side effects from maybe that one statin. So there's a lot of reasons that our patients use and are looking to use CBD, from relaxation to improving sleep, to relieving joint pain, to improving skin care, to addressing menstrual cramps, and even sexual enhancement. And all ages are utilizing CBD. We see each and every year that from millennials to baby boomers, the percentage of uses have been increased from different regions as well as different ages. So let's look a little closer at CBD, or cannabidiol. It has many medicinal benefits to the body. It can help reduce bacterial infections. It can inhibit cancer cell growth. That's why you're seeing so many of our oncology colleagues are using CBD, because they're utilizing this holistic way of addressing nausea and vomiting for their patients who are undergoing chemotherapy. CBD also helps to reduce blood sugar levels. So you see our endocrinology colleagues utilizing CBD to help to reduce the amount of metformin and even insulin that their patients are on. And then CBD also helps to reduce small intestinal contractions. So our gastrointestinal GI colleagues are using it in their practice to address Crohn's disease and ulcerative colitis and diverticulitis, as well as CBD helps to be a vasorelaxant. It helps to improve blood flow to major organs and glands. It helps to improve high blood pressure, hypertension. So our internist colleagues are also utilizing CBD, or are open for their patients to utilize CBD to reduce the amount of antihypertensive medications. Well, there are other cannabinoids that the plant makes that synergistically, when you combine in a full spectrum product, the CBD along with the CBC and the CBG and the Delta 8 THC, we can see the synergy of one cannabinoid with another really having an amazing effect on a cellular level and really showing the body how it can be put back into balance. Well, let's look at some of the other cannabinoids that can be produced by our body. Because yes, the plant offers cannabinoids. We just talked about many of them. They're called phytocannabinoids, the CBD, CBC, CBN, CBG. In fact, the plant makes over 140 different cannabinoids to date. Well, our body also produces and manufactures cannabinoids like anandamide and 2-AG. See, anandamide is the cannabinoid that our body produces that gives us the bliss, that gives us the joy, that gives us the happiness. And the 2-AG is the cannabinoid that our body produces that really helps to reduce inflammation and pain. So you can see the anandamide is kind of analogous to the THC, and the 2-AG endocannabinoid is analogous to CBD. But when our body is undergoing a lot of stress, when our body is not being fueled with good nutrients, and our body is not getting the sleep, our body is being bombarded with external stressors like pollution in the air, then these endocannabinoids can't produce like they're needed in the body. So this is why every single person in your life, every single patient needs CBD. And I know that sounds very, very dramatic for me to say that every single person needs CBD, but we do, because our body needs to be put back into balance with all the internal as well as the external stressors that the body undergoes and is not able or capable of producing those endogenous cannabinoids like 2-AG and anandamide. So the way that cannabis works in the body is fascinating. You know, when I was introduced by CBD by our CEO, Melissa Boston, I was like, well, how does it work? What is the science behind how CBD works? And here's the science. It's called the endocannabinoid system. This is a regulatory system. It's a physiological system that we all possess, that when we consume cannabis, cannabis binds to these major receptors, CB1 and CB2 in the body, and sends signals to different areas to put the body back into balance, or to reduce inflammation, or to help us sleep, or to help us be more calm and at ease, or to put our blood pressure into balance, or our blood sugar. So this physiological system regulates and modulates our temperature, our metabolism, our sleep-wake cycle, our immune system. These receptors are found in our brain, our central nervous system, our heart, our lungs, our kidney, our liver, our skin. Every single organ and gland in our body has receptors and pathways that when we consume cannabis, it puts the body back into balance. Well, there's other concerns as healthcare professionals that we need to think about when our clients and our patients are on CBD, and that is, will it react with other or interact with other drugs? Well, the answer is yes, it could potentially interact positively or negatively with other drugs, because many drugs that our patients are taking are metabolized in the liver. It's metabolized through the CYP450 pathway. So that's why when our patients are on CBD, we recommend that they talk to their doctor, and if they're on certain medications like a blood thinner called warfarin or Coumadin, that they have their blood levels checked a little bit more frequently. If they're on an asthma medication like Theophylline, that they have their levels checked more frequently. Doesn't mean that your patient can't utilize CBD, but it just means that we have to do some more frequent blood checks on those patients that are on medications that metabolize through this pathway. Another concern our patients have is, will CBD show up on my drug test? And the answer is, if that CBD product is topical, if they're putting topical lotion on, or if they're putting a topical pain cream on, that CBD will not show up in their urine drug screen. The other answer is no, if that client or patient is using a broad spectrum CBD product. Broad spectrum means that that product contains less than 0.0% of THC. Then that urine drug screen would not show up positive. But if that patient is using a full spectrum product, a product that has the legal limit of THC, which is 0.3% or less, there is a potential that yes, that urine drug screen could be positive. In fact, they did a study and they looked at folks who were taking between 1,000 to 2,000 milligrams of a full spectrum CBD product on a daily basis. And it turned out that there was an 11 to 23% chance of detecting THC in the urine drug screen. So for all of those patients that you have, you can safely recommend our products that are topical. You can safely recommend all of our products that are broad spectrum for them to have a negative urine drug screen. Now, when we talk about urine drug screens, most of the employers are using point of care. These are pretty much those drug screens that you find over the counter. They're not very sensitive or specific. So you want to recommend that your patient, if they are undergoing urine drug screens, that their employer uses a urine drug screen that is utilized by LabCorp. It is a CBD to THC ratio. It's a very, very specific and sensitive urine drug screen that can detect if that person is using a CBD product versus a person that's using a marijuana product. There are so many things that you need to understand as a healthcare professional. And if you're not a healthcare professional on the line, that you need to understand before buying a hemp-derived CBD product. And that is, where is the product sourced from? Is the product sourced from a hemp farm that is being grown organically? Why is that important? That's important because hemp is a bioaccumulator. So it will accumulate what's ever in the soil. If there's mold, mildew, if there's heavy metals, if there's pesticides in that soil, it will be accumulated and consumed in that product. So our Wakana products are sourced from suppliers that are growing their hemp organically. How is the CBD extracted from the biomass? That's really important too. There's several different ways of extracting the oils and the products from the plant. We utilize a supercritical CO2 extraction process. That's a very clean method, though it's more expensive. It is a cleaner method for the consumer as well as the environment than propane and butane. Is that product third-party validated, tested? Does that product come with a certificate of analysis? And the answer is yes. All of our products are sourced from organic farms. They're also, they come and tested with a third-party validation, allowing all of our products to have certificates of analysis that allows the physician, the healthcare provider, as well as the patient information that, one, the product has the legal limit of THC, which is 0.3% or less, and other factors that are important, that the product is free from mold, mildew, heavy metals, pesticides, residual solvents, bacteria, and mycotoxins. All of this is very important. So what's inside the bottle is very important. Where the product is sourced is very important. How it is extracted is very important, because not all CBD products are made equally. There's a lot of CBD products that you can purchase at the gas station, at the smoke shop. Those are not products I would trust. I would not trust my patients to utilize. They are not tested. They are not sourced from organic farms. So choose a brand like Wakana that can stand behind their products. So again, our products are extracted by the cleanest method, which is a supercritical CO2 extraction process. And there are many, many ways of consuming CBD. We're going to talk about some of our products, but CBD can be consumed orally as a tincture under the tongue. It can be consumed via a smokable product, that is a vape cartridge or a pre-roll. It can be consumed as a water-soluble product in your liquids like your water, your juice, your tea. CBD can also be consumed as an edible through a gummy or through a spice, or even infusing different foods and consuming it that way in an edible. It can be consumed by swallowing a capsule. We have amazing products where those patients who don't like to hold a tincture or an oil underneath their tongue, they can swallow the capsule that's infused with CBD. And then there's topicals, one of my favorite ways of utilizing CBD. Topicals offer that local relief where we are getting CBD to reduce inflammation and pain. So when we look at some conditions that we treat every single day, like diabetes, starting with a very small amount and starting slow is very key when you're introducing CBD to your patients. Starting with 2.5 to 20 milligrams per day is a great starting dose. And just knowing that we can't make claims when we utilize CBD, that we are talking about helping and assisting our patients address some of the symptoms that diabetes can have. even when it comes to cholesterol levels, starting low, starting slow. 2.5 to 20 milligrams per day is a great starting point, but looking at some of the symptoms that those who have high cholesterol may have that we can assist with as well. So when we look at the data, when we look at the science and the research, I like utilizing PubMed. PubMed is a great resource for healthcare professionals to look at studies where cannabinoids are being used to treat difficult and manage difficult pain, like your sciaticas and your neuropathies, how CBD cannabidiol can be used as a potential treatment for anxiety disorders, PTSD, even schizophrenia, psychiatric or more serious mental conditions, as well as cancer treatment, utilizing CBD as a therapeutic potential for reducing nausea and vomiting, as well as we talked about GI docs, they're utilizing CBD to really help assist and address diverticulitis, ulcerative colitis, Crohn's disease. These are some of the studies that show how utilizing a non-psychoactive cannabinoid like CBD can help to prevent and even treat GI disorders. This is one of my recommendations for those clients who want to address symptoms due to diverticulitis. They can utilize a gummy. They can utilize even a topical and a tincture, synergistically utilizing all three products so that CBD is in the bloodstream at a steady state 24/7. Rubbing that topical cream on the area where the intestinal tract is really causing a lot of cramping and pain. Utilizing the gummy so that one can sleep at night. Folks with diverticulitis or any chronic condition has a lot of anxiety, a lot of sleepless nights, as well as using the tincture twice a day, again, to reduce inflammation and pain. So let's talk about some of our other products here at Wakana. We have, again, the broad spectrum, which is the products that are utilized for your clients, your patients who have random drug screens. Those are all the products that are in the white label or have the word pure on them. They are very safe for those who have urine drug screens at work. And then we have the power products or the black label. Those are our full spectrum products. They have the legal limit of THC, which is 0.3% or less. And they are also products that are utilized for those who do not have urine drug screens at their job. The FDA disclaimer just states that the statements made regarding these products have not been evaluated by the Food and Drug Administration. The efficacy of these products have not been confirmed by FDA-approved research. These products are not intended to diagnose, treat, cure, or prevent any disease. And this is really key, that we want to really make sure that our clients, our customers, our patients understand that we cannot make any claims and that all information presented here is not meant as a substitute for or an alternative to information from healthcare practitioners. Please consult with your healthcare professional about potential interactions or other possible complications before using any products. The Federal Food, Drug, and Cosmetic Act requires this notice. So we offer elaborate lineup of safe and effective CBD products. We have smokables, tinctures, edibles, hair care, sexual health topicals, essential oils, and sanitizer. Our third-party testing, again, comes with certificates of analysis that are very easy to interpret. We have one-pagers, pass, fail, and they go through all of the testing that our products have as it relates to mold, mildew, heavy metals, pesticides, residual solvents, etc. So our other tinctures that I want to talk about, on the left is our Hempranium 500 milligram. That's our #1 selling tincture. Start with three drops twice a day, a great starting dose. That'll give you about 10 to 12 milligrams of CBD just from that one tincture. We have the pure tincture for the broad spectrum for those who have urine drug screens. That's 300 milligrams of CBD. Again, 3 drops under the tongue twice a day. And then our water soluble, our power water soluble. That's our full spectrum product, 500 milligrams, 3 drops twice a day in water, juice, smoothies, etc. Our Hemp MD is here. That Hemp MD is our most potent tincture, 900 milligrams. Again, starting with 3 drops twice a day. I love using the Hemp MD for those who have more severe challenges and conditions. And then our hemp powered hair is a tincture or it's a topical. If you are undergoing random drug screens, you're going to use it as a topical to address hair thinning and hair loss. Some of the other highlights of our #1 selling tincture, our Hempranium 500, is that it has a enhanced essential oils for the CBD to really have its full effect on the body. We have added black seed oil and turmeric along with our carrier oils, MCT coconut and hemp seed oil. See, our products here at Wakana are very unique in that we've enhanced the CBD with other amazing essential oils to like black seed to improve the blood sugar levels by black seed rebuilding the beta cells of the pancreas, improving inflammation by adding turmeric, also improving memory and enhancing emotional well-being. Our topicals, our Extreme Power Pain Cream is our #1 selling topical. It is 400 milligrams of CBD. I love using this product at night on those sore knees, sore shoulders, a sore back. My daughter and I just worked out this afternoon. I'll be utilizing that cream so it can really set in at night and give me relief and not wake me up in the middle of the night. Our Dr. Rita's Rub is a formulation in a liquid format. It utilizes, as well as the Extreme Power Pain Cream, 6 to 8 essential oils that help to reduce inflammation, reduce pain, and really give that immediate relief that we need on the external or topical muscles and joints. We offer a serum for the face. It's a CBD serum for the face, our Holy Glow, to address and reverse aging and to address those wrinkles that we all want to avoid. We have a body cream, our Power Mango Body Cream. And remember, anything that's topical and power or full spectrum will not pass the blood-brain barrier. Our Power Mango Body Cream addresses the skin, the dryness that we have from washing our hands, as well as providing the skin to have that extra moisture. Our edibles include our gummies. We have our broad spectrum gummies. We have our Delta 8 gummies. We have our sexual enhancement gummies, our King of the Jungle gummies. We have our weight loss gummies, our flat belly gummies. We have our flat belly brew, which is an organic brew coffee, not like Dunkin' Donuts or Starbucks, but a brew that helps to reduce the appetite. It helps to reduce cravings for carbs and sugar, along with those flat belly gummies. Really helps for you to maintain and to even lose weight. Our essential oils include our frankincense and myrrh, eucalyptus. I use peppermint every morning before I either teach or do a workout. I put peppermint on the soles of my feet. It's a natural energy, right? Instead of drinking a Red Bull or any of those other toxic drinks, I can get my natural energy that is being infused to the largest pores of my body, which are in my feet, and has a long-lasting result. Our Essential Defense and our First Defense, I want to bring attention to these two products. The First Defense is utilizing CBD along with essential oils, and it is a nasal spray. So it is delivered right where the bacteria and viruses enter our body. So First Defense is a must to help to improve our host, to improve our immune system as we are going through, again, the uh, global pandemic. You know, there's a rise in the numbers again. So you all want to get that First Defense in your hands. Our smokable products offer very quick relief within 1 to 5 minutes of 1 to 3 pulls on either that vape cartridge or that pre-roll will give you relief, will give you a relaxation, will give you reduced inflammation and pain, whatever the condition or challenge that you're facing, and you need a very acute and quick result, you want to utilize the smokables. They also have an increase in bioavailability. So when you smoke CBD, when you vape CBD, it's giving the cells more of the CBD quicker and faster. Our spices, along with our gummies, are infused. They're not coated. So we have our garlic fire, our flavor king, our chili lime, our vegan butter, our culinary plus. All of these products can enhance your recipes along with giving you medicinal benefits to the body. Our hair care system is super, super important for those who have had COVID and lost their hair due to COVID, for those who are undergoing chemotherapy and may have lost their hair. As long as there's a follicle there, these products can assist to restore the hair back, to maintain the luster of your hair, and to also address men, their beards, as well as women when we talk about alopecia. Our sanitizer, or our Royal Defense, is our sister company. We pivoted very quickly when the global pandemic first hit. We knew that there needed to be products for our essential workers, our frontline workers, as well as each and every one of us that want to keep our home and our office safe and sanitized. We offer a hand and surface sanitizer. We offer a produce wash, can be used on your, if you're still eating animal flesh, can be used on your meats, and we offer masks as well. So when we look at the global pandemic and all of those folks that were shut in, right? They said more Americans were having sex. So we knew that we needed to have a very, very, very important presence in sexual health with CBD. We offer CBD lube that enhances not only the ability of the vaginal area to stay lubricated, but it also enhances the sexual health of those women who are undergoing perimenopause or menopause. Our King of the Jungle gummies can be used by men or women. CBD, along with the other organic herbs in that gummy, help to dilate the vessels, helps to improve blood flow to the penis and the testes, as well as improving libido. We have body butters that are infused with CBD and hibiscus and lotus that really put those couples in the mood. Now, the recommended usage for all of our products are on the bottles, they're on the website. But I want you to really understand that you always want to start slow and you want to start low. You want to start with a minimum amount and then you can build up. So 3 drops of the tinctures in the morning, 3 drops of the tincture in the evening. The gummies, you want to start with a half or even a quarter if you're talking about Delta 8 gummies. The pre-rolls, I can't stress this enough. Your customer, your client, if you're a healthcare professional, your patient doesn't need to smoke the entire vape cartridge or the entire pre-roll. That's way too much CBD at once. So 1 to 3 pulls is all that you need. So there's so many great choices. You know, you can't go wrong. We are the crown jewel of CBD. And hopefully as a healthcare professional, or maybe you're not a healthcare professional, maybe you have more insight now that cannabis is a plant that really utilizes the species on the hemp side to give us the health without the high, and that we here at Wakana have products that are safe, products that are effective, and products that are tested. I want to thank you for your attention. I want to thank you for your time. If you have further questions, you can email me at ritamd@wakana.com. That's ritamd@wakana.com. I also want to invite you to our 8 o'clock call. Our 8 o'clock call is different from this call because we're going to give you a business overview, as well as we're going to show you how you can bring in an extra stream of income. We all need that additional stream of income. And if you have a private practice, if you're in business for yourself, you want to join us in 20 minutes for our business overview. If you're a guest on the line, you want to connect with the person that invited you. The person that invited you will give you the Zoom ID, which I think was on that flyer, and give you the password so that you can hear more and more about our company, about our products, and about the opportunity. So I'm going to take a couple of questions. If you have a couple of questions out there, you can put in the chat. If not, no worries. We'll see you in about 20 minutes on the 8 o'clock call. You have my email, ritamd@wakana.com. That email can be used to have more of your questions answered, or if you have a desire to be on our medical advisory board and you're a healthcare professional, we would love to have you on our board. You can email me about that as well. So it doesn't look like there's any questions. Thank you, Tawanda. If you're a guest on the line, connect with the person that invited you so that you can get products ordered, you can get your questions answered, and we will see you in the next 20 minutes. Be well, be safe, and God bless you all.